Hello again for the Ask Dr. Payne segment. This question involves what are the requirements for breast reduction? Not very specific here. It's not clear to me whether the person was asking whether we're talking about insurance coverage for a breast reduction or just what do you need to do to be able to have a breast reduction. Let's address both. If you're talking about getting insurance coverage for a breast reduction, the carrier, the insurance carrier, is going to have different criteria that have to be met to make sure that there is a medically necessary reason for surgery. Now, there is no universally accepted set of criteria. So you're going to have different things that have to be met by different carriers. The basics of it are that because a breast reduction involves a breast lift, insurance carriers are suspicious that people are really getting breast lifts and not really breast reductions, so that's why this has come about. What I would say is that if there are symptoms, the breasts are heavy, they're pulling, sometimes there's rash under the skin, and that would be the medical reasons for doing a breast reduction. Now, not all carriers will be satisfied by the reasons for the surgery. So, especially in an era now of increasing deductibles, it's worthwhile to just get it done if you can and you want it done. Whether or not it can get covered by insurance, that's getting to be a tougher situation. So you can have a breast reduction if your breasts feel too heavy to you, and they will be lifted at the same time. The amount of reduction depends on how much you're looking to remove in terms of the excess tissue and how bad the symptoms are and so forth. Whether or not it gets covered by insurance, though, again, a more difficult question because sometimes it has to be quite large and really down for the insurance company to cover that, and depending on which insurance company you are dealing with. So again, if you want them smaller and you're talking about a cash pay situation, that can be done, without a problem, and you may or may not be able to get reimbursement back from your own insurance company if you are dealing with an out-of-network plastic surgeon. So keep that in mind, and hopefully that will help you in getting that procedure addressed.